India is a treasure trove of information. Over generation, there is a lot of knowledge that has been transferred from generation to generations. In this modern world, it's not just from generation to generation that this knowledge is being handed over. We are also seeing this knowledge moving outside India to new countries. We as an Indian diaspora has also been a reason for promoting most of these arts, dance, and various Indian traditional practices over to new countries. One interesting practice that also has found new acceptance outside India is Ayurveda. Dear viewers, today we are glad to have Dr. Syal Kumar, who has been having experience of more than 15 years in Germany in promoting Ayurveda and its practices to the German community. Dr. Syal Kumar, thank you for your time for today, for spending some time for CGI Talks, and welcome to CGI Talks, sir.
Thank you very much. Thank you very much for the invitation. It's my pleasure and honor to be here to talk about Ayurveda.
Thank you, sir. I have to say this to the viewers before itself that the doctor had to travel around 3 hours just for this interview. So again, appreciate your dedication towards Ayurveda for doing this, sir. So we'll get into the topics of this. So before getting into the topics, let's get to know your background, you as a person, and how this all started off for you, sir. So let's start with your influences and inspirations for this, sir.
Actually, I'm born and brought up in a family of Ayurveda. I'm the fifth generation of Ayurvedic doctors.
Wow.
My father, my grandfather, my great-grandfathers all were Ayurvedic doctors.
Mm-hmm.
So during my childhood, Ayurveda is all around me. Because my father is already having a hospital. It's from my grandfather. So it's just at the other side of my house.
Mm.
So every day I see patients dealing with parents, especially father. So I used to see on my childhood only Ayurvedic patients.
Okay.
And even my mother was a teacher. So when she's going to work and when I'm having holidays or something like that, so father used to take me to the hospital. And I will be sitting on his lap and he's consulting the patient. So, and then in India it's the tradition, then you are into Ayurvedic thing.
Understood.
So then, and I am the younger from in the family, so I am supposed to be the Ayurvedic doctor, follower of discipline. And then I went to the Ayurvedic college.
Okay.
So I did my BMS from Coimbatore Ayurveda College.
Okay.
And then, so normally it's like that after BMS, parents used to force, come my cherries, I have to take rest and things like that. So I thought, again going back home and sitting there because there is no fun hospital, it's not like that, the life.
Understood.
So then I thought, okay, I'll go for PG. So I did my MD.
Okay.
And then, because in all our family there are a lot of doctors. Actually, my grandfather was Ayurvedic doctor. His brother was modern medicine doctor.
Okay.
And my grandfather was MLA in Kerala in those days. And my grandfather's brother was health minister.
Okay.
For a short time in the Kerala Assembly those days.
Okay.
So, and because of that, we do have some understanding and also a lot of connections into medical field, and many of my uncles, aunties, many are in medical field.
Okay.
Many are in modern medicine doctors.
Understood.
And my uncle is Ayurvedic doctor. Okay. My brother is a modern medicine doctor.
Okay.
His wife is modern medicine doctor. So they are in UK. So because of that, there is a big medical background.
Understand.
And that inspired me to go for MD and other further courses in Ayurveda. In those days, people are not so much aware of doing PG, PhD and things like that. So I was motivated because of this background.
Okay.
And my brother was also very much supportive to come out from this kind of setup and doing post-graduation and further things.
Okay, interesting.
So that was also a big inspiration for me.
Okay.
Because those days, that time he was already in UK. So I thought, he's out. So I saw that the modern medicine doctors are going outside to UK, USA, doing FRCS, FRCP and things like that. So for me, it was also very interesting to spread Ayurveda internationally.
Okay. So so that was in fact my next question actually, because Ayurveda, when you see from a practice point of view and acceptance point of view, it is mostly an Indian-based act, and most of its awareness is in India. So, what led you to take to the next step of coming outside India, and how did it end up in Germany? So,
Actually, I was after PG. I was working in India, and then I met one of my colleague,
okay,
and was asking to the possibility to come to Germany because Ayurveda there is not much real Ayurveda there.
yeah,
So I was okay. I was anyway looking to go out. My intention was going to English-speaking countries like UK or USA or something like that.
okay,
But Germany, I was also very interested because when we look Ayurvedic patients coming internationally, mostly are from Europe, and also mostly from Germany.
You mean the ones who come to
Come
India?
to India.
Okay.
Some of the hospitals where the Europeans are coming, and Germans having a big domination there.
Okay.
So that was also inspiring to come to Germany. And when we are in you hear about Germany, people are very technically good, and also a lot of culturally close to Indian culture and things like that. Sanskrit and German very close and things like that. And also our Malayalam dictionary was out from German. So that also was a big inspiration for me. And then I came to Germany. And after coming to Germany, I realized slowly the hurdles. First was the language. Those days it was 20 years before. I came 2003 in Germany.
Okay.
So then, normally in India we think, okay, this is English is everywhere. So I was those days struggling to read English newspaper. The only possibility I came to Karlsruhe that time. Okay. And I got the opportunity to work in Karlsruhe government hospital with my colleague.
Okay.
So we started there a small clinic there.
Okay.
And then we started giving lectures there.
Okay.
So like that we started our beginning.
So you said your brother was in UK. So how come Germany was a choice for you? I mean, you could have decided other countries like that.
That is also very interesting because when you compare with the Germany and UK, UK is not so much into natural medicine or Ayurvedic medicine.
Okay.
But Germany, among there was a statistics among Europe, the German-speaking countries are more into natural medicine and Ayurvedic medicine.
Okay.
So Switzerland, Austria, Germany, and among that Germany is the most acceptable country to Ayurveda. So many Germans are open to Ayurveda and other natural medicines.
Okay. So coming to your journey, was there any particular instance or person that influenced you to come to Germany?
Yeah, actually the colleague, he was also very interesting to bring me here. And then the thing was that I was thinking once I came here, I realized that the degree is not accepted.
In Germany?
In Germany, our Indian BAMS degree is not accepted in Germany. Even if MD degree is not accepted. So this all I didn't know before. Then I got a possibility to work like a dietitian.
Okay.
But it was not so for me interesting because I did my MD and all. So working with patients only with diet advice and all is not so inspiring for me.
Exactly.
And those days, many Ayurvedic practitioners, supposed to be Ayurvedic doctors and practitioners, doesn't have any basic knowledge of Ayurveda.
Yeah, we'll come to that later. So that was also an interesting question. So you started off with as from a clinic, and then you went to the MD level over here. Like how did that journey happen for you then?
Yeah, actually, it was not accepting here. Then I have to plan what's next. So I thought of going back to India.
Okay.
So and then I realized that there was few incidents happened because I realized that the Ayurveda is it's not in a proper hand. So if we people go back, then there will not be authentic people here to support.
Understood.
So I thought of sticking on here, and the colleague was very much supportive. Then I start learning German because initially I was staying on to English. But the patient was not so satisfied.
Understood.
And then I started learning German. And then the next possibility to work like a medical professional was heilpraktiker or modern medicine doctor. Okay. So I incurred for the modern medicine. Then it is like that. I will get 1 or 2 semester free because I did the modern medicine in Ayurvedic, but then the rest I have to do.
Okay.
So again, it takes around 6-7 years. So then I thought going for the alternative, it was Heilpraktiker. Heilpraktiker is a complementary medicine practitioners. You have to learn, you can learn there are some schools here, but you have to write an exam.
Okay.
The exam is done in the health ministry, from the health ministry,
okay.
you know.
Okay.
So, Gesundheitsamt, you know, and if we have passed the exam, then you can officially practice complementary medicine and also Ayurveda.
Okay.
You know. So then I went for that. I went almost two years the course, and then I went for the exam, and then I passed. Then during that time, I got before exam, I got the opportunity to start a research possibility in our university hospital.
Okay. And where was that, sir?
It was in Duisburg as well.
Okay.
Yeah.
So let's talk about Duisburg and its connection to Ayurveda. So when you started, was it the time when they had this research?
No.
Okay.
This history of Duisburg as a chair of natural medicine is very interesting.
Okay.
Because this is almost the first chair of natural medicine and integrative medicine in Germany.
Okay.
It was headed by Professor Tobosch. He's a big shot in natural medicine and integrative medicine to all over Europe.
So did it start in 80s, 90s or?
Yeah, exactly.
Okay.
Exactly. Yeah. So almost 25 years before they started that. And the setup is like that. They got modern medicine. It's a university hospital. They got a modern medicine department and supported by many other departments like natural medicine, natural Chinese traditional Chinese medicine, traditional European medicine.
Wow.
And when I came, we started the department of traditional Indian medicine, Ayurveda.
Oh, okay, interesting.
Yeah, so we started there. And before, also they were doing a lot of research. And we do have a very strong and big department for yoga, yoga meditation.
Okay.
So for me, the entry was a little bit easy because the platform was already there. I just want to build our department. The hospital for integrative medicine, this is, we do have a inpatient department and also an outpatient department.
Okay.
So we try to treat patients in an integrative medicine approach.
Okay. So I'm just curious, like when it comes to Ayurveda, most of the base and foundations for the medications is our Indian-based plants and herbs, right?
Exactly.
So for a research facility, you would obviously need access to all of this. Now, in a country in the northern hemisphere, how does it happen? How do you get all access to all of this?
Yeah, this is very interesting question because it was the first hurdle happened when we started the research. So we did two research. One was for low back pain, and another one was for irritable bowel syndrome. Okay. We managed to get the ethics committee approval because but they didn't approve all the medicines, all the plant ingredients because they told it's not registered in Germany.
Understood.
Because of that you are not allowed to make the research. So then somehow we managed to complete without some other plans, with some limited plans, Ayurvedic plans.
Understood.
What we are now doing since almost 10 years, we do the research design. And we do have collaboration with Indian colleges and universities. So we fund the clinical research in India. And then we do the statistics. We get the data, and then we do the statistics, and then we publish together.
Understood.
That's now what's happening.
Okay, understood. Okay, fine. So now let's jump into Ayurveda's more detailed questions, sir, and we'll come back to this point about research also later on. So let's talk about this as a practice and its acceptability towards the German community over here. Over the last 15 years, how have you seen this evolve as a acceptance point of view?
Yeah, almost 20 years.
20 years, yeah.
Because I started those days with dietitian kind of work, So from there I can see that it's a big change happening now. I will tell you an example. I used to travel a lot. So normally people will sit nearby me and then they ask, you're Indian, what are you doing? Then I tell, I'm an Ayurvedic doctor. Then they tell it a bit suspicious. Now, Ayurveda? Initially I couldn't understand what's the matter. Then later I realized that the word Ayurveda is spoiled here. So the word Ayurveda, many for them, it's like kind of massage stuff. Or esoteric stuff and things like that.
Okay.
So, but I have to explain them. No, you see, this is a real university study.
Yeah.
You have to study 5.5 years basically, and another 3 years MD with research and things like that. Then they really come into the point. No, because those days it was Ayurveda is like massage. Still now, but it's a big change now happening.
Okay, understood.
Yeah, but when we compare now, because then now I am working in a university hospital, then it's a little bit different. It's more serious.
Okay.
Patients realize the effect of Ayurvedic medicine.
Okay.
Many ways. Some they go to India in a proper hospital to kind of beach or something like that, with their chronic illness, and then they do have a positive effect, and then they come back and then they search for hospitals where Ayurveda is functioning.
Okay.
Otherwise, they read a lot of things about Ayurveda, and we do also a lot of promotion. We regularly do talks, seminars, publications and things like that.
Okay, understood. So that leads to my next question again, is normally there is this comparison culture that we have, right? So this being a medical practice, there is also this discussions about, this comparison between Ayurveda and modern medicine. So this has been a generational conflict is what I feel. So what are your views on this? I mean, how is this being addressed from a German medical practice point of view here in Germany?
Basically, like I told before, our concept in our hospital is like giving the patient the best medical medicine. So we do have many medical options. So modern medicine is there. So we try to do integrative medicine.
Understood. Okay.
So integrative medicine, like sometimes we can combine everything. Sometimes we need only this medicine for this disease or this disease condition. So like that we manage to tackle the issues with the patients. With the modern medicine, actually there is no much conflict in our area, in our hospital, because everybody knows which area is strong, which Ayurveda is strong in which area.
Yeah.
That's also a fact. You see, every medicine got its own limitation. We cannot tell that there is complete medicine. Ayurveda got its own limitation. Modern medicine got its own limitation. Chinese, everything there. So we look, where is the limitation? Actually, modern medicine is very good in high-tech medicine, surgeries, and all those. It's super. But when it comes to the chronic disease, it's not so much into that. They can manage it with painkillers or cortisons or something like that. So in this area, natural medicine is very, very effective. Especially Ayurveda, Chinese medicine, European natural medicine, and things like that.
Okay, interesting. So let me lead you to another question regarding this. Now you mentioned that you have this generational journey, of 5 generations in this. Now every generation is different. Now with technology being so fast in the past 5 years, I think everything changes very fast now. We've reached to a generation where fast remedies and quick responses is something that is more looked upon for. Now Ayurveda is known for a long-term treatment, a long-term remedy, and patience with patients, if I can use that. So how does you as a practitioner in this industry, how do you feel is Ayurveda equipped to manage this kind of change in this new generation, sir?
I think if you see the kind of patients coming to us, that means the trend is like that. They go first to the general practitioners, house asked here, and then they go to specialist, many specialists. And then they come to Chinese medicine, and then they come to European natural medicine. Then they come as a last resort to Ayurveda. So 99% of patients are like that. So that means already chronic disease, and with this kind of thing, again 3-4 years wait.
So this is a trend you mentioned. This is in India or Europe, everywhere it is the same case.
Everywhere it's in India it's more better. I am talking now
on a German context.
So in Germany it's like that. So there are few, but it's not like in a general hospital setup, it's totally different.
Yeah.
Because we have to face the real challenge with the patients. It's not like wellness or massage or something.
Yeah.
So this is the trend. They come as a last resort. And for us, or for me, it's very easy because all the investigation is already done. Many MRI reports, many scan reports, everything is there. Blood results, everything is top blood results, everything. So in that way, modern diagnosis is perfect. So we have to work with Ayurveda. Okay. So when we talk to these patients, and chronic patients, mostly what we treat is pain. Okay, because our hospital is for pain, is a pain clinic, chronic pain. Okay. So my cases are mostly rheumatoid arthritis, osteoarthritis, low back pain, migraine, gastrointestinal problems. Skin is also there. Some neurological cases are there. So this is our area.
Okay.
So all these patients, they come maybe after the diagnosis, maybe 5 years, 10 years, 15 years. So if you tell, okay, it takes some time, if there is a cure, then they are immediately they are open for that. And they are compromised for waiting.
Okay.
If you tell, okay, it takes some time, minimum 3-4 months, then okay, no problem. But the main intention is that we will get relief.
Okay.
Because of that, I don't feel any much difficulty. And Germans are very punctual, and they obey what we tell. Here, Germans, everything they will write it down, each point, and then ask a lot of questions. We have to be perfect in that. You have to keep everything very clear. Then it's good.
Okay, understood. So one curious question that I had, general for Ayurveda, regardless of which country, is do you also have for mental health based also a wing in Ayurveda, like psychology?
Yes, exactly. Because we do have a vast area of psychological disease possibility to treat.
Okay.
Actually, my father and my grandfathers, grandfather, great-grandfather, they all were treating psychiatric patients too.
Okay.
So I see in my childhood many psychiatric patients.
So you mean recordically Ayurveda also has a psychology?
Exactly. Because if you look, we do have 8 branches in Ayurveda, and 1 branch is psychology.
Okay. Interesting.
And in all the hospitals we do have, university hospitals, we do have a separate department of psychology. And I basically come from Kerala. In Kerala, in Kottakkal, there is a big psychiatric hospital exclusive for Ayurveda.
Okay.
And the Ayurvedic college, and supported by Indian government.
Okay.
Irish department. Yeah.
Okay, now let's come back to Germany, sir, and 2 more questions topical that I wanted to cover. One is, now we talked about giving this as a complementary medicine to patients. Now, how are you managing that also from the medical system over here, like Krank and Kasa and all? Do you see a future where Ayurveda and related practices like this can also be, received to patients, general patients, through this system of social support?
Actually, that is our pioneer work, what we are doing now.
Okay.
Because our department, for Ayurvedic department, we do have many activities other than patient management.
Okay.
We do have research, we do have education for doctors. We do have a course for 3 years for doctors, modern medicine doctors, and we in a collaboration with Indian college.
Okay.
That means they can do first year in our place, and after that they can go to India and take the intensive course there.
Courses. Okay.
So we do have a MOU with the Kottakkal Ayurveda college and things like that.
Okay.
And then we also teach medical students in the university in Essen. So that means in the Department of Integrative Medicine, they got a curriculum for integrative medicine and natural medicine in the university hospital in Essen.
Wow.
Now this is very rare in Germany. Okay, so there me or my colleagues, they go according to the appointment, and we give lectures about Ayurveda or other medicine. I represent Ayurvedic medicine.
Okay.
So I will go there and give lectures on Ayurveda there. So it starts from 4th semester. Okay, and they come to our hospital and see patients and do the clinical studies and things like that.
Okay.
So because of that, we do a lot of awareness in the basic level of doctor students and also for the doctors.
Understood.
Okay.
Understood.
And then we do have publication.
Okay.
Almost 25 publications we already have.
Yeah, so that's again another question that I had is when you look at this from an academic and research point of view, most of these were previously in India, it was orally transferred, then we had this recordically moved. Now, again, so how does the whole translation for German happen, or do you have most of this in English? How is the academic side?
It depends actually. If it is an international journal to publish, then it will be in English.
Okay.
But it's a regional journal, then it's in German.
Okay. So do you also have students and scholars who are also helping in getting most of our Indian records translated to German?
Yeah, actually it's not students because in our department, I am the main person who is doing all this activity. But some of our colleagues, staffs, they try to support me in these areas.
Okay.
Yeah, exactly.
Okay. So that's interesting. So let's come to the government support in this, because we have initiatives like Ayush and all. And recently I've seen a lot of activities happening under the aegis of Ayush. So how are these helping you build that awareness and also increase the reach of Ayurveda? Like,
I think Ayush is doing a wonderful job since last almost 10 years.
Okay.
After Modi ji came, he already did a separate department for Ayush, and there is a minister.
Okay.
It's a big, huge change.
Okay.
It's a big support for Ayurveda and all other natural medicine system in India.
Okay.
Yoga and things like that. Yoga Day.
Understood.
And the Dhanvantari Jayanti celebrate Ayurveda Day and things like that. So, and it's not only for marketing but also for academic level and also in the research level. Ayush is collaborating with a lot of universities.
Okay.
And also funding and supporting real serious research.
Okay.
And also publication.
Understood. Okay, good. Yeah, in fact, I actually saw a lot of awareness activities also happening under the consulate aegis, also a lot of Ayush-related activities. So that's good to see that there is a lot of awareness happening. So before getting to the final segment, one last question is, we touched a bit on this previously also. You mentioned about a lot of information out there. Now we have this Google and information age that is there. Everyone,
Dr. Google.
Yeah, exactly. Or WhatsApp University, as they say. So everyone you meet is an expert nowadays in any. So nowadays you have those people with half-baked information coming as expert telling that this. So do you also have this in the Ayurveda area?
Yeah, I think it's very extreme in Ayurveda.
Okay.
Because there are two ways, not only from the Google information or other platforms, but also people who go to India. Okay, not maybe patients or otherwise like tourists. They go to India, they go somewhere in beach or something like that, and they do some small course about Ayurveda. Okay, and they come back and they are kind of experts here. And this is a big issue happening.
Okay.
And they try to treat. They just write books. Even in India, if you go to a bookshop, you cannot see many Ayurvedic books. But I was wondering here, you go to a bookshop, there will be minimum 5 to 10 Ayurvedic books written by non-Ayurvedic groups.
Understood. Yeah, so in fact there is a trend where you just put the word Ayurveda before, then it becomes something sort of like Ayurvedic cuisine or Ayurvedic cook or all those things. Okay. So Ayurveda not having a governing body, do you think this is something that should be worked upon?
Yeah, I think it's coming up now. The WHO, they already supported Ayurveda as a medical system, alternative medicine medical system. They made a lot of guidelines for practice and education. It's a big change for that. And also I think Ayush Ministry is also coming up with a lot of ideas. And I think that will be a big change in internationally Ayurveda. And I forgot to tell you, I did also a PhD from here. So I got my doctor title.
Also in Duisburg?
Collaboration with Duisburg and Austrian University. And there I did my doctorate work was how Ayurveda can be integrated in a GP clinic in Germany.
Wow. Okay.
And a lot of things came out. All these factors came out. The illegal and all the issues. And then I made a conclusion as what can be done for that. And then it was sent to Ayush department.
Okay.
And it was very interesting that they accepted. And
Which year was
it was in 2017. 17. Yeah. But I find that they accepted that, and they told me, yeah, we are very interested and we'll work on that.
Wow. Okay.
Yeah.
Okay.
But I think out of that, there are many works happening under Ayush.
Okay, understood. So there is potential, you mean, to put Ayurveda also next to a GP here over here?
Definitely, because many of our students who comes to our Ayurvedic course, they are practicing Ayurveda as a GPs.
Oh, okay.
No, they are different. Many are GPs or specialists.
Okay.
So they already integrated the Ayurvedic system in their clinics.
Okay.
We started the course in 2008. Okay, so almost more than 16, 18 years.
Okay. Nice.
And so we do have a lot of doctor students.
Interesting. In fact, there's lots to talk more, sir, but we have to also address the fact that the content has to be also valuable for people to view in a short time. So let's come to the closing segment of this, sir. So how do you see the future of Ayurveda in Germany and going forward? Because looking back, you have 20 years. You said about times where you felt that there is a need of Ayurveda, more awareness. Now we have reached a phase where we have a lot of Ayurvedic practitioners and also as a big community, I think, of Ayurveda doctors. So how do you think it is going forward now?
I think there is a big future for Ayurveda.
Okay.
Because Ayurvedic system, why I tell that Ayurvedic system is the only system in medical system where you can give intensive tissue cleaning. Okay, cleansing of the tissue. It can be only done by Ayurveda.
Okay.
So Chinese medicine or European natural medicine, they tell cleaning procedures, but only for the gastrointestinal tract. But we go more deeper into the tissue level with the Panchakarma treatment all. These all are the basic concept is cleaning the tissues.
Okay.
Where the disease pathology is strong. Okay. So many diseases like autoimmune diseases, COVID and COVID-related problems, post-COVID, post-vac, and things like that. We do have a wonderful result.
Okay.
So many colleagues, modern medicine colleagues, or in some of the seminars and all, many modern medicine doctors, they used to ask me, how your medicine is very old, more than 3,000, 5,000 old. Those days there was no any disease like Parkinson's or COVID or MS or rheumatoid arthritis. So how you manage? You'll be struggling to treat that. So for us, it's very simple. We are not treating the disease. We are not interested in the diagnostic labels. We are interested in the patients. Patients, what is happening in the patient's metabology. So that's why we work with the doshas, the basic 5 Panchamahabhutas.
Okay.
If it's balanced, then it's health. So for that, because of that, it's very easy for us to treat, even though it's difficult to treat, but the method of treatment for us is very simple. I mean, simple means it's very easy.
Okay. Wow, sir. Thanks a lot, sir. Because Ayurveda being a generational practice that has lots of years of knowledge, you were able to concise this into like 40 minutes. So thank you for that, sir. I know there's lots more to discuss. There's lots more to know from you. So I will put your contact details also, maybe, so people you're also available in social media, so people can get in touch with you. And thank you for promoting Ayurveda, and looking forward to more of your work, sir. Thank you. Thanks a lot.
Thank you very much. And it's very interesting to talk to you. And the work what you're doing is very wonderful to put out all these special areas like Ayurveda to the public. Thank you.
Thank you, sir. Namaste.